Welcome to Wednesday. Hello, I'm Len Cannon. We are working every day to make sure you understand the COVID vaccine, which is imminent. It's part of our special series, The Best Shot. There may be a light at the end of this tunnel, folks. Tomorrow, the FDA will hold a hearing to decide if Pfizer's COVID-19 vaccine should get emergency use authorization. But this type of vaccine has never been approved in the U.S. before. Stephanie Whitfield explains how it works.
There are 330 vaccine candidates being worked on all over the world. 11 are in clinical trials in the U.S. Here's what they're all working toward: making the body produce antibodies which protect against COVID-19. How they do that depends on the specific vaccine. Pfizer and Moderna are the furthest along in clinical trials with their messenger RNA vaccines, which is a brand new method never approved in the U.S. before. The idea is messenger RNA sends a message to the body to create what are called spike proteins. Those proteins are found on the outside of novel coronavirus cells. Once your body forms spike proteins, it triggers an immune response. So if you ever come in contact with the real COVID-19, which also has spike proteins, your body will already have the antibodies to fight it off. The messenger RNA vaccine contains no live virus, so experts say you cannot get COVID-19 from the shot. Early results from Pfizer and Moderna's clinical trials have shown their mRNA vaccines are 95% effective in preventing symptoms of COVID-19. What we don't know is how long that immunity lasts. Stephanie Whitfield, KHOU 11 News.
Boy, we know you have a lot of questions about the vaccine. You can text those questions to that number, 713-526-1111. Also text the word vaccine to the same number. We'll send you links with the latest news.